Hello everyone, welcome to the channel. I am Dr. Jyoti Verma. We are starting a brand new series on spinal anesthesia. Not just the basics, but everything you actually need to know. What stands between your needle and a perfect subarachnoid block, about a layers of anatomy and a whole lot of precision. Let's get started. In this class, we will discuss spinal cord, vertebrae, ligaments, epidural space and its boundaries, comparison of cervical, thoracic, lumbar and sacral vertebra, vascular supply of spinal cord, and finally the structures pierced during subarachnoid block. Spinal cord runs in the spinal canal. Spinal canal extends from foramen magnum till sacral hiatus. So, spinal cord is an extension of brainstem and it ends at conus medullaris. Conus medullaris has two extensions. One is known as filum terminale. Filum terminale is a fibrous extension of conus medullaris, and the neural extension of conus medullaris is known as cauda equina. If we talk about adults, the spinal cord ends at lower border of L1. But in infants, the spinal cord lies a little lower. It lies at L3. So while giving spinal anesthesia, we have to avoid going above L1 or above L3 in infants. We have to avoid injuring the spinal cord. So the membranes which cover the spinal cord are pia mater, arachnoid mater and dura mater. Innermost membrane is pia mater. It is highly vascular, and between pia mater and arachnoid mater lies the CSF, or also known as subarachnoid space. The volume is around 30 to 80 ml and the daily production is around 500 ml, which is quite a turnover for such a small space. Then arachnoid mater is non-vascular and it acts as a barrier. It does not allow multiple drugs to pass through it. Dura mater is the outermost layer of spinal cord, and outside dura mater lies the epidural space. If we talk about vertebra, this is a simple diagram showing parts of vertebra. So the anterior part is vertebral body. It is a solid part which is followed by pedicle. Pedicle connects the body with the transverse process. Transverse process is followed by lamina. Lamina is a connection between transverse process and spinous process. So the parts of vertebra are vertebral body, pedicle, transverse process, lamina and spinous process. In the center, there is a hole which is known as spinal canal or vertebral canal where the spinal cord runs. If we talk about ligaments, this is a sagittal section of vertebrae of spinal cord, and we can see all the ligaments from anterior to the posterior region. So talking about anteriorly, anterior to vertebral body lies anterior longitudinal ligament. Posterior to vertebral body lies posterior longitudinal ligament. Spinal canal, after spinal canal is ligamentum flavum. Ligamentum flavum is followed by interspinous ligament, which is the ligament between two spinous processes. Above the spinous process lies the supraspinous ligament. If we have a cross section of transverse section, so if we see, this is the anterior region of vertebral body and this is anterior longitudinal ligament. Posterior to the vertebral body lies the posterior longitudinal ligament. This is the ligamentum flavum. Above the spinous process and below the spinous process will be the interspinous ligament, and posteriorly will be the supraspinous ligament. If we talk about epidural space and its boundaries, we will discuss the boundaries as well as the contents of epidural space. So epidural space consists of three things: Nerves, blood vessels and lymphatics. Nerves, blood vessels and lymphatics are present almost in every part of the body. So these three things are easy to remember. Then the other two things are fat and areolar tissue. Fat helps in increasing the duration of lipophilic drugs. So these are the contents of epidural space. Talking about the boundaries, anteriorly lies posterior longitudinal ligament. Laterally lies pedicles and intervertebral foramina. Intervertebral foramina is nerve root canal. It is a passage for nerve root to go to the peripheries. Then posteriorly lies ligamentum flavum and lamina and spinous process and interspinous ligament. Ligamentum flavum, flavum means yellow. Ligamentum flavum is a yellow ligament. It has two parts, right and left. It can be divided into right and left parts, or the two parts can be unified. So it is not uniform. So if we superimpose the epidural space on a vertebrae, so this is the spinal canal, and we are assuming that around the spinal cord is the dura mater, and around the dura mater is the epidural space. So the anterior boundary is formed by posterior longitudinal ligament, which is behind the vertebral body. Laterally lies the pedicles and intervertebral foramina. Posteriorly lies ligamentum flavum, lamina, spinous process and interspinous ligament between the two spinous processes. Talking about epidural space, it extends from foramen magnum to sacral hiatus. It has subatmospheric pressure, which is why when we confirm epidural space using hanging drop, the drop gets sucked in. The other ways to confirm epidural space is loss of resistance to air or saline. Skin to epidural space is 5 cm to 8 cm. It depends on patient's weight as well. The abdominal pressure is transmitted to epidural space. This can be seen in patients who are obese, who are pregnant. So, increase in epidural pressure increases the rise of drug. So, the intrathecal spread of drug increases, or the epidural spread of drug increases by increase in epidural space. The CSF, let's talk CSF. CSF pressure is 15 centimeters of water, and its volume varies with age, and varies with body habitus and weight as well. It is formed by the choroid plexus. Daily production is around 500 ml, and usually the subarachnoid space consists of 30 to 80 ml of CSF, and that's it. Talking about cervical, thoracic and lumbar vertebrae. So how do we know where we are? So we can use landmarks. C7 is also the spinous process of C7 is known as vertebral prominence. So you can feel it on yourself. The most prominent structure on your neck is vertebra prominence. This is the spinous process of C7 and it is bifid. If we talk about thoracic region, the inferior angle of scapula corresponds to T7. If we talk about lumbar region, we can feel the iliac crest of the patient, and the two lines, the line joining the two iliac crest is the Taffier's line, which corresponds to L4, L5 intervertebral space. There can be a variation of 1 or 2 intervertebral spaces. If we talk about body of the cervical, thoracic and lumbar vertebrae, the cervical body is small and transverse processes originate from the body only. In thoracic region, the body is heart shaped and medium size, and if we compare it with lumbar body is large. Spinal canal is triangular and large in cervical vertebral body. It is smaller and circular in thoracic vertebral body, and it is triangular and large in lumbar vertebral body. The spinous process is bifid in cervical vertebral body and perpendicular to the axis of spine. The thoracic spinous process are angled caudally. That is why we have to direct our needle carefully to reach the subarachnoid space. The axis of spinous process, the position of spinous process of lumbar vertebrae is perpendicular to the axis of spine. Transverse process arise from the vertebral body in cervical vertebrae, and there is a transverse foramina in cervical vertebrae as well. This is the transverse foramina. So, in thoracic and lumbar vertebrae, the transverse process originates from between the pedicle and the lamina. Talking about sacral and coccyx, in children, the sacral vertebrae are joined by cartilages, but as the puberty is attained, they get fused. And coccyx is a small triangular bone which is the fusion of 3 to 5 vertebrae. So this diagram will clarify it further. This is the sacral promontory and this is the fusion of vertebral bodies. This is known as transverse ridges and this is the body of first sacral vertebra. There is sacral foramina for sacral nerves to pass through, and this is a diagram of fused coccyx bone. Talking about the blood supply of spinal cord, there are 2 posterior spinal arteries and 1 anterior spinal artery. The irony here is that one spinal artery supplies a larger portion, anterior 2/3, and the 2 posterior spinal arteries supplies the 1/3 portion of spinal cord. Posterior spinal arteries are branches of inferior cerebellar artery. Anterior spinal artery is a branch of vertebral artery, and there are segmental arteries as well, which are branches of intercostal and lumbar arteries. There is one major branch which is known as artery of Adamkiewicz. It supplies the lower thoracic and upper lumbar region. As the anterior portion has only one spinal artery and supplies the major anterior 2/3 part of the spinal cord, it is prone to ischemia. So the anterior and deep portion of spinal cord is prone to ischemia and can lead to anterior motor horn neuron injury and anterior spinal syndrome. The other segment which is prone to ischemia is T3 to T9. If we talk about the venous drainage, it follows the similar distribution. There are 3 longitudinal anterior spinal veins and 3 posterior spinal veins. They drain to segmental anterior and posterior radicular veins and finally drain into the internal vertebral venous plexus, which lies medial and lateral to the epidural space. Finally, we will be discussing the structures pierced during subarachnoid block. As we hit the skin with the needle, the skin is pierced followed by subcutaneous tissue or fat, which is followed by supraspinous ligament which lies just above the spinous processes. Supraspinous ligament is followed by interspinous ligament which lies between 2 spinous processes. And after this, we get a pop by piercing ligamentum flavum, which is hard structure. That is why we get a pop. And as we pass through ligamentum flavum, we reach the epidural space. If we have to give a subarachnoid block, we will go further. We will pierce the dura mater followed by arachnoid mater to reach the subarachnoid space. If this breakdown helped you, hit that like button and subscribe for more. See you in the next one.